So the next video is about the written assessment, which is usually in the form of a scenario that you then have to answer how you would assess and plan that patient's care. So in an earlier video, we talked about care planning, and this is more about the assessment of a scenario and about how to present it with your written English. In our preparation pack, we have several examples of scenarios and how to answer them. You may have a scenario which is a non-acute scenario, which might be something like you have a 73-year-old man admitted after a fall and you notice that they have a red area on their sacrum. What would you do? Or it might be a more acute scenario like you have a patient that's had surgery and when you record their observations, they have a temperature of 39 and a blood pressure of 80/50. What would you do? Now, from experience and working with different trusts, they like that you use the ABCDE form of assessment. Now, if you're not familiar with the ABCDE form of assessment, you can go to our educational file and there's an article in there and there's also several scenarios with examples of how to use the A to E assessment. If you don't feel comfortable using the A to E assessment, you can use any means which you want to, but make sure that it's clear, it's concise, and that it gets to the point. So if you're not familiar with the ABCDE form of assessment, A stands for airway, B stands for breathing, C stands for circulation, D stands for disability, and E stands for exposure. In a short while, I'll give you an example of how to use the A to E assessment within a clinical scenario. So for example, if they gave you an acute scenario that said, you have a patient that's complaining of chest pain, and how would you assess the patient? I would say, first of all, I would talk to the patient and check their airway. So I would write airway and then say airway clear or no obstruction, no stridor, no wheeze. Then I would move on to breathing. Breathing would include things like monitoring the oxygen saturation levels, checking the respiratory rate, looking at the rate and depth of breathing. Are they using any accessory muscles? Have they got oxygen on? Whether you'd put oxygen on. Checking an arterial blood gas, whether the patient needs to be sat up. Does the patient need a chest x-ray, etc. Then you can move on to circulation. So circulation would include an assessment of the blood pressure, the pulse. Is it regular? Is it irregular? Is it thready? Is it bounding? The blood pressure, is it high or is it low? Has the patient got intravenous access? Has the patient got intravenous fluids? You would check the fluid balance. You would look at the urine output. You would check the temperature. And that's the sort of things that you would look at for circulation. D stands for disability. And this means an assessment of the patient's conscious level. And this could be via a Glasgow Coma Scale, or it could be assessing just whether the patient is alert, whether they're responsive to pain, whether they're responsive to voice, or whether they're unresponsive. It's just a basic assessment of the patient's conscious level. And then exposure is everything else. So it can be a top-to-toe assessment, checking for signs of infection, looking at pressure area care, how is their nutrition, what drugs are they on, looking at their medical notes, talking to the family, escalating to your senior nurse, etc. Now, if you use an ABCDE assessment, generally you will cover all the main points, but you need to think about, for example, if you have a patient that is complaining of chest pain, I would make sure that you say within that you would give them analgesia, that you would check their pain score, that you would give them anti-sickness if they needed it, and that you would record an ECG. So when you look at your scenario, the most important thing to do is read it very carefully because the clue is usually in the scenario, and use a pen and underline all the main points and make sure that you address all those main points within your assessment. So you can do assessment and then you can think about how you would plan the care for that patient and how you would implement the care for that patient and how often you would evaluate the care for that patient. Things that you should always include are that you would talk to the patient, that you would protect their dignity and privacy, that you would inform the doctor if you needed to, that you would inform your senior nurse, you would let the family know, and that you would document everything. We talked earlier a little bit about documentation, about record keeping within the NMC Code of Professional Conduct. So you should always say that you would document the care that you've delivered. So for example, I'm going to talk about a scenario and then I'm going to say how I would answer it. So the scenario is you have a patient that's admitted through A&E. They have a temperature of 39, they have a blood pressure of 90/50, and they have a heart rate of 135. What would be your nursing actions? So first of all, I would say, I would check the patient's airway. Are they talking to me? Is there any evidence of obstruction? Then I would move on to breathing. What's the patient's respiratory rate? What's their oxygen levels? Have they got oxygen on? Do they need oxygen on? In this case, I would say that the patient definitely needs oxygen on. And are they using accessory muscles? Is there any concern about what their acid-base balance might be? So would we take an arterial blood gas? And then I would move on to circulation. So I know that the patient's blood pressure is already very low. I would want to know what their urine output has been. I would want to make sure that they have intravenous access. Do they need antibiotics? The patient has obviously got a high temperature and a low blood pressure, so they've probably got an overwhelming infection somewhere. I would also want to think about, have they had bloods taken? Do they need an ECG? What else? Check their temperature, try and bring the temperature down. So maybe we'd give some medication to try and bring the temperature down. Then I'd need to look at their conscious level. So I'd check whether they're alert, whether they're responsive to voice, responsive to pain, or unresponsive. I'd check their pupil size. Are they reactive and equal? Do they have equal strength in all of their limbs? And then I think the most important point within this is about exposure. So we need to think about, where is their source of infection? Is it their chest? So do we need a chest x-ray? Do we need to send a sputum sample? Do we need to send a urine sample? Have they got any wounds that we don't know about? Have they got any leg ulcers or pressure sores that might be infected? And if they have any wounds, then we need to swab them and send them for analysis. We also need to think about, how has their state been before they were admitted to hospital? So we need to find out some medical history about them. We need to look at medication. We need to talk to family. We need to talk to the patient and see if they're comfortable or if they have any pain. And then I would say that I would monitor the patient closely, probably recording their observations every 15 minutes. Make sure that they have a senior doctor review, that they would be monitored, that I would document everything in the notes, that I would give any medication that's prescribed, and that I would speak to the family and the patient, keeping them informed at all times. You can find online more information about using the ABCDE form of assessment, but I would definitely recommend that you look at it before your interview and you're familiar with the terms that you may need to use when you go for interview. Not only does practicing scenarios help with your vocabulary, but it also demonstrates that you have good assessment skills. Within our educational file, there are several examples, or if you want to, I can send more examples for ones that you can answer, and I can also send you sample answers for that scenario. It's a good idea to practice different scenarios and see how well you can remember different terminology, and also structure your answer in a fashion that it is concise and that it's easy to interpret and it's easy to read.